Good morning. Let's try that again. Good morning.
Morning.
Good. It's an honor to be here. I was invited because I can talk about the past because I'm so old that I can relive the past. I want to give you sort of my perspective on past, present, and the future. I want to talk about the historical events in autism. Does the speaker work too? I want to be able to walk around. I can walk around. I think a huge day in autism, the huge year was 1943. In 1943, autism was identified as a separate diagnostic category, and Leo Kanner had 11 children that he felt weren't mentally impaired, didn't feel they were schizophrenic, thought that there was something different about them, and autism was born in 1943. So in the history of ASD, that's the starting date in ASD. It's not that children with autism didn't exist before 1943, they certainly did. They were just called something different. So I'm starting the historical events in ASD with the discovery, the identification of autism. In 1965 was another time period that in the past I think was important. In 1965 is when treatment for children with autism started in earnest. Up to that time, very little was done in treatment. Most of the research had to do with more about the diagnosis, the prognosis, but very little in treatment was being done prior to 1965. And the treatment that was being done was rather ineffective. In 1965, Ivar Lovaas, a pioneer in the treatment of autism, started working with children with autism and working with their behavior issues, as well as teaching them language and play and social skills. So in 1965, we turned the corner on treatment. The next day that I think was next year that I think was quite important in the history of autism in the past was 1973. 1973 was the time that a study came out, an outcome study, where they looked at a group of children with autism to see the effectiveness of treatment. And this was some of the work that came from 1973 study. This first graph, what it illustrates, is that children with autism had tremendous potential. If you look at the graph, it talks about their IQ scores before and after treatment. And what was remarkable was that indeed you could produce changes. Prior to 1973, the belief was children with autism had a very bleak prognosis. There's very little that can be done in treatment of autism with autistic children. But in 1973, they demonstrated that indeed children could change and make some significant changes, seeing quite a big jump in their IQ scores. Perhaps the more important graph from that study in 1973 was this graph. They looked at children across 5 different categories. They looked at their self-stimulation, their echolalia, those were interfering behaviors, and they looked at verbal behavior, nonverbal, and play behavior. And they looked at them before, during, and after treatment, follow-up. And what they found in this study was, once again, children made dramatic progress. All children improved with treatment. Again, remembering in 1973, the belief was children with autism really could improve significantly. What made this graph even more significant is they looked at 2 groups of children. They treated 19 children. They looked at a group of children who lived with their parents, and they looked at a group of children that lived in state hospitals. And this is what they found. Looking at self-stimulation, you saw with treatment, in both groups, behavior went down. Self-stimulation was reduced with treatment. If you look after treatment, those children that went back to state hospitals, their self-stimulation increased dramatically. But those children that went on and lived with their parents, and their parents were trained what to do, their self-stimulation continued to be reduced further. They looked at echolalia, when children mimic back, repeat what they hear. They saw the same phenomena. It improved in treatment in both groups. But when the children went back to state hospitals, their echolalia returned above their base level. And with the children that went with their parents, it continued to improve. Looking at appropriate verbal behavior. we saw an increase in the behaviors. So children in both groups learned how to talk and communicate. But those children that went back to state hospitals, their communication went back down. Children that lived with their parents, it continued to improve. Social behavior, almost the same phenomenon, not quite. Social behavior improved dramatically in both groups, more so in actually the children that came from state hospitals. When they went after treatment, they both declined, including the children's and parents group. And finally, when they looked at play skills, we saw the same thing. What was dramatic about this study was a group study, the first group study ever done in autism. Again, way back a long time ago. The two things that came out of that study was indeed children with autistic disorder could make significant improvements. Their prognosis was not bleak. They just needed good treatment. The other thing that came out of the study was recognizing how just important parents are. If parents aren't trained and knowledgeable in what we're doing, the results will not last. And that was the year 1973. The next date that I think is important, I'm biased, so this is all according to how I view it, was in 1987. Another study came out, a group study, and I was part of that study. This was what we did. We treated 38 children. 38 children were diagnosed independently. So a diagnostician, not part of the UCLA Young Autism Project, diagnosed these children. Treatment began at the age of 4. It was early intervention. We were working under a large grant from the National Institute of Mental Health, who wanted to know under best practice conditions what could be done in the treatment of autism. And one thing they knew was early intervention was important. Half the children, 19 of the children, received intensive ABA. By intensive, it meant an average of 40 hours a week of treatment. And they received only ABA, so no other treatments. It was just ABA, no speech therapy, no occupational therapy, no medical treatments, just ABA. That was the experimental group. The other 19 received an average of 10 hours of treatment a week. They also received other treatments. So in addition to ABA for 10 hours a week, they received speech therapy and occupational therapy. Intervention occurred for 2 or more years. The average was 3.5 years. And intervention occurred across settings. In the community, at homes, in the clinic, at school. After treatment was done, they were placed in 3 outcome groups post-treatment. They were either placed in the poor outcome group, the fair outcome group, or the best outcome group. Back then that was called recovery, the recovered group. This is the criteria that we used. If children's IQs were in the profound or severe range after treatment, and or they were in classrooms for autistic disorder, and or they still presented with the diagnosis of autism, they were placed in the poor outcome group. To be classified in the fair outcome group meant IQs were in the moderate to mild range. They were in special education classes other than autism. They were mostly communication disorder classrooms. And they presented with a diagnosis other than autism. And usually it was a communication disorder diagnosis. To be in the best outcome group meant, after treatment, your IQ was in the normal range on a standardized IQ test, that you were in general education classrooms without supports, meaning there was no aid, no assist in the classroom, no program plan, they were indistinguishable educationally, and they presented indistinguishably. They went to get full evaluations, and they did not present with the characteristics or behaviors of autism. If that was our children, that was the criteria of being the best outcome group. Let's look at the results from that study. The children in the experimental group that received an average of 40 hours in ABA only, 2 children were in the poor outcome group, 8 were in the fair outcome group, and 9 achieved best outcomes. Meaning 9 children were indistinguishable. They did not present with the behaviors or characteristics of autism, IQs in normal range, and were in general education. And if you think back, this was 1987. The study was actually completed in 1981. This was remarkable, that 9 children could present without autism. Their IQ changes. The 2 children in the poor outcome group lost 15 IQ points, which is not surprising given that the test became more complex, testing more abstract thinking. The children in the fair outcome group increased by 11 IQ points, and the children in the best outcome group had a 38-point increase. Again, quite remarkable. If you compare this with the children that received 10 hours anaplectic therapies, these were their results. No children made it to the best outcome group. What we suspect happened when treatment meant, meaning ABA only and intensive, we made a change to 1 outcome group. We suspect if the first group, the experimental group, had gotten 10 hours as well, there would have been 0, 9, and 10. So we made a change in 17 children's lives with treatment. We added a 3rd outcome group at the end of treatment just to see how they compare. The 3rd group had 0 hours of treatment, and of ABA and eclectic treatment, and their results were very similar to the control group. These were the results that we achieved at UCLA. Again, leading the field to recognize that children with autism had amazing potential. Because again, the thought, even in the 80s, was that children with autism would have a very restricted life. Once autistic, always autistic. That you could not make dramatic changes. But indeed, the results of this study showed you could make dramatic changes. I want to show a video from 2 children from the study. This is a child that's representative of the middle outcome group.
No, sit down. No, we don't want to pick him up. No, we want him quiet. Down team, quiet. Ready, point to the left. Point to the left.
After treatment, Val's IQ rose 23 points, from 34 to 57, and he improved sufficiently to be placed in classes with language or mildly delayed children.
The weekend.
I went to Disneyland.
And what do you write?
What did I write? Let's see, I went on Pirates of the Caribbean and the Matterhorn.
I didn't write Matterhorn.
You didn't? Why?
Because I'm scared.
It's too big?
No, I'm scary.
Too fast?
No, too scary.
Too scary, man.
Val did very well, but he wasn't in the best outcome group. He was in the middle outcome group, the fair outcome group. This is a child, this is me, by the way, 40 years ago, as a young undergraduate student. This is a child that was representative of the best outcome group.
Ian had no words or communicative gestures. He had severe tantrums. He ignored or looked past people. He spoke objects, flapped his hands, laughed excessively and inappropriately, and assumed fixed and rigid body positions for prolonged periods of time. With intensive treatment, Ian's IQ at follow-up rose more than 40 points to the normal range.
Well, when we found out about this problem, we were told that he would probably be institutionalized at some point in his life, and we couldn't accept that for us. And it was grueling, really. I mean, because it was, I would say about 5 years of the therapy, 2 years very intensive therapy, another 3 of consistent hard therapy. He was seeing daily changing, and that's what kept him going.
I just stay in the sand, play with sand.
You play with sand. What else did you do?
And I just put sand in my head, and I didn't eat it.
You didn't eat it?
Yeah, we don't eat sand.
No, it's not good to eat sand, is it? It doesn't taste real good.
It doesn't taste.
How do you like 6th grade so far? Pretty cool. It's a lot better than 5th grade. I don't know. Kindergarten was boring, and I know that it's just you little pace, little like
The
that.
boys were asked to talk about their lives.
Do you think college is going to be fun? Yeah, it's going to be pretty cool. Yeah. That's what you usually find your girl that you marry. When are you going to get married? I don't know. I want to get married right now. even if I was able to, because it doesn't seem fun right now, you know. Probably after college, that would be fun. Yeah. About 24, I'd say. And that's year after I move out. That's going to be me and all those parties too at college. Oh yeah. It's drinking beer and everything. Sweet the room.
He did really well. And again, he was representing the child in the best outcome group. He did go to college, by the way. Not only got his bachelor's degree, he got his master's degree. Great group of friends, avid skier, has lots of passions and hobbies, been in relationships. He's done really well. And he was unusual. Again, there was 9 children that had outcomes just like he did. Okay, another day that I think was important was in 2011. We produced an outcome study at Autism Partnership, and we looked at what we were doing, and it was published in this journal. Let me go through what our criteria was. We looked at 64 children that got treated across 4 of our offices. The age and intake was from 13 months to 8 years of age. They received an average of close to 22 hours a week of intervention, and the average duration of treatment was 4.5 years. The best outcome criteria is very similar to what we used at UCLA. IQs in the normal range, in general education classrooms, and no longer present with the characteristics or behaviors of autism. And these were the numbers we achieved across our 4 offices. So 45 out of the 64 that we treated ended up having best outcomes. Again, demonstrating the effectiveness of ABA, demonstrating, though it doesn't need to be in a research setting, it can be in a community-based kind of program as we do in Autism Partnership. Outcomes in Autism Partnership that we showed in terms of our data was that this represents a child with an IQ of 100, typically a developing child. For every year chronologically, they pick up 1 year developmentally. Children that do not receive ABA through the course of time has shown this is what their pattern is. As you see, as time goes on, the gaps increase significantly. They don't progress very well with time as they age. We found in our study that 10% of our children had this kind of outcome, 20% this, and 70% this kind of outcome. So 70% of our children were very close to exceeded typically developing children's outcomes. I want to say that it's not just our studies that show the effectiveness of ABA. Oftentimes they point to there's a very few studies that show the effectiveness of ABA, and that's just not true. There's a whole host of studies that show the effectiveness of applied behavior analysis. Too many to really put on all the slides. There's been over 1,000 studies that have shown the effectiveness of ABA. So you get the idea, it's not just the work we do, it's ABA in general that's been shown to be quite effective. Present, future, 2016. We're starting an Autism Partnership, what we call CABA, the Center for the Advancement of Behavior Analysis, saying that's near and dear to us. Because our concern in the field of ABA across the world is that there's not enough well-trained people in doing behavior analysis. There's a lot of people doing behavior analysis everywhere. I was just in Kuwait a couple weeks ago. There's 2 centers in Kuwait that are doing behavior analysis. But they're not doing good behavior analysis. Because not all ABA is alike, and I'll talk about this afternoon a little bit about that. There's tremendous differences among ABA, just like there is in any profession. There's tremendous differences in speech pathologists and doctors. There's differences, and the same exists in ABA. We as a group are very frustrated with the differences. We want to help train professionals across the world in having quality treatment so that they can maximize children's progress and outcomes. Because we know from our history, children have just amazing potential if they get quality ABA treatment. And so we want to open this center. We will be opening this center in September of 2016. Here's a little bit of information about what we plan and why we're opening it.
Autism spectrum disorders are neurobiological in nature that result in severe language and social issues that make living in the real world very difficult.
So pretty.
Throughout the years, we've been devoted to providing high-quality treatment. Our passion has been stoked by the families and children we've served.
We work in a tremendous field. We see children who have no language and learn how to speak. We see children who are lonely and sometimes depressed, and they end up having meaningful friendships. Ultimately, every day, we get to help the lives of children with autism and their families.
Right here, buddy. Good. Love how you're waiting. All right, are you guys ready to do Herman the Worm?
To provide the best treatment requires very careful research. Our clinical practice is at the heart of the training program. We display proudly the accomplishments of our research team.
We now know that about 1 in every 68 children are affected by autism. Early intervention makes a difference. It's about the quality of the people who are doing the intervention.
They would know all the subtleties of his behavior really, really well, and they could address, those things that are really specific to him.
In the past 20 years, we've really seen a de-emphasis on training professionals in the field of applied behavior analysis. This has resulted in children not making the gains that they're capable of making.
It has to change. It's simply not acceptable that there are not enough professionals.
I was really surprised to learn that the majority of places that we called, they essentially would send a high school graduate with about a week of training. They aren't equipped to do this. I don't know how I would have reacted to ABA or even believed if it worked, if that was the first experience I've ever had.
By having high expectations, they're going to be able to achieve amazing progress and lead rich and fulfilling lives.
Very few are getting the quality of intervention that's necessary to help them become productive members of society. I've seen them graduate college, and it's always a good thing.
Our goal, our mission, our passion is to train professionals so that they can impact children and families' lives throughout the world. And so it's through this PAVA that we're going to be able to accomplish this. This is what we think the future is. As we say, our goal is to provide training across the world so we can do quality applied behavior analysis and advance the field of ABA. Keep on pushing. We've been doing this since 1965 in ABA. We're getting better and better in doing it. And children are having a high quality of life because of the treatment they receive. We just want to make sure everyone receives the same opportunities. Thank you so much. I will turn it over to the next speaker.